My name is Mike, and this is my story with Galleri. My girlfriend and I, Krista, we live here together with our two Woodles. We like to play pickleball, ride bicycles, play golf. I like to fish whenever possible, and we like to travel. We were very, very active before I got sick. Krista, she had a sister who was aware of the Galleri test and had mentioned it to her. Galleri is a proactive screening test, allows you to screen for some of the deadliest cancers before any symptoms develop.
When I heard about it, I was immediately intrigued and wanted to take part of that just to make sure everything was going to be, good for my health. I had the HSA health savings account that I was able to access and use funds for that.
The results came back fine for her, and she said, "You ought to go take this test," and I did.
He took it a couple weeks later, and then when he got his results back, it was quite a shock and a surprise to hear that there was any type of signal detected in his results. I was even more surprised how specific the area of origin was with the head and neck area.
Got a phone call about 10 o'clock in the morning. It was a nurse who worked at Mercy, and they wanted to get me in and schedule me for a CT scan as soon as possible. The lady said, "We've got a whole team of people here. We'll walk you through this." I was amazed at the number of people I began to interact with. The CT scan indicated that there was something in my right tonsil and then in my lymph nodes in 3 or 4 places, some masses. And from there we went and got the radiation treatments and the chemotherapy treatments.
He had absolutely no indication, no symptoms at all that he had cancer. And because we were able to detect that early, it really changed the outcome of his prognosis.
After I completed the chemotherapy and radiation, they scheduled me for a CT scan, and it came back good. And every 3 months after that, I've had a CT scan, and they've all been good so far. I kind of feel like I'm one of the luckiest guys there are, because if I didn't take this test, there's no telling how far that cancer may have spread. I plan on taking the test again as soon as the doctors say that I can.
Based on a clinical study of people ages 50 to 79, around 1% are expected to receive a cancer signal detected result, which includes predicted cancer signal origin. After diagnostic evaluation, around 40% of these people are expected to have a confirmed cancer diagnosis. The Galleri test is prescription only. The Galleri test is recommended for use in adults with an elevated risk for cancer, such as those age 50 or older. It is not recommended in individuals who are pregnant, 21 years old or younger, or undergoing active cancer treatment. Galleri does not detect a signal for all cancers and should be used in addition to routine cancer screening. False positive and false negative results do occur.